Hello everyone, I'm Jim Masters and welcome to CU TV News. This is the show where we talk to today's top thinkers from all around the world to bring you information, inspiration, and thought-provoking ideas that you can put to use in your personal or professional life right now. Today, my special guest is Dr. Vatsala Sastry. For some 30 years now, Dr. Sastry has been a renowned medical professional specializing in infectious diseases. She has specialized training in the diagnosis and treatment of infectious diseases, also known as contagious diseases, which are those that stem from pathogen from a host organism. These infections may spread to other carriers through physical touch, airborne inhalation, bodily fluids, or contaminated foods. Dr. Sastry identifies whether the disease is caused by bacteria, a virus, a fungus, or a parasite, often through blood tests, and then determines what course of treatment, if any, is necessary. Dr. Sastry believes making an excellent diagnosis is extremely critical to standing up to infectious diseases. She says the goal is to heal what can be healed. In order to prevent serious complications from arising from infectious diseases, Dr. Sastry never gives up on her patients to come up with an accurate diagnosis and highly effective treatment. She says her whole purpose is to help patients regain their health so they can move on and live happy lives. To learn more about Dr. Sastry's incredible and pioneering work in the medical field and in treating patients with infectious diseases, she joins me in the CU TV News studio for this exclusive interview. Dr. Sastry, it's a true honor and a pleasure to meet you. We've done radio shows together on CU TV News Radio Live. We've had some really fascinating conversations on the broadcast series on radio. So it's a real pleasure to have you here at our television studio so we can dig a little deeper in our interview today. Welcome.
Thank you very much. Just want to let you know it is an absolute honor and a pleasure to be here and to be able to bring out the wonderful things that we've done, and it certainly is a delight to have you do that for us. So we thank you.
Well, we thank you very much for being here, and we've got a wonderful conversation in store today during our interview as we talk about your amazing career. But before we even get into the career that exists today, I'd love to know some of the backstory a little bit as far as the early years for you, some of the things in your life early on that inspired you to want to pursue a career in the medical field, and specifically then leading to, of course, infectious diseases. But first, what is it about medicine that spoke to you early on and some of those early inspirations?
So when I was born, I spent the first 1 or 2 years in India, and then after that came to this great nation, New York City, and spent most of my young years in New York City. But during all this time, what I would be coming across was a lot of certain friends, relatives, etc., who had certain issues, and the family would tell me that they got much better because they went to physicians. And regarding the infectious disease component of it, when I was back in India as a young girl, they would say, you can't go here, you can't go there, you got to dress this way, change this, wear that. And I found that very unusual, and a lot of the explanations weren't given. You were just taken there, here, there, like that, and we came back and I just felt fine afterwards. So as I started growing up, I said, why when we went to that place, why was it restricted? Why could we not attend that building or see that relative or see that friend? And then slowly the explanations came out. And then I recognized that later on we were able to see all those people. So I said, so whatever they had has been resolved, has been fixed. And it was through the physicians. So therefore, when I came and with this wonderful country and the incredible opportunities that it gives all of us, and the capacity to grow and become what you wanted to be, so then I chose to be a physician and an infectious diseases doctor.
And then what is it specifically about infectious diseases that spoke to you? Did you go straight into infectious diseases, or did you study and pursue other areas of medicine first that led to the specialty of infectious diseases?
Absolutely. Actually, when I grew up a little bit later, my brother's a thoracic surgeon, and I had wanted to become a surgeon, but he had chatted with me at great length. He goes, back in the 60s, 70s, 80s, he says it's a little bit difficult. You're going to have a hard time, and if you want to get married and become a mom, it will be a little challenging for you. So why don't you try a few other options? So then I said, well, I love internal medicine, love infectious disease. So I went on, and then I slowly started that and started working on it. I also did a little anesthesia easier for a while, but you cannot communicate much with the patients. It is a phenomenal high-risk activity, and it's a wonderful job and occupation, but I wanted to chit-chat more with the people. So then I chose to pick up medicine, and then I picked infectious diseases. It became even more prominent to me because the most important thing about it is that it is reversible. A lot of it is reversible. It is preventable, and that is the beauty of infectious diseases. So hence I said, you know, I can make a difference in many people's lives, and I can work on so many things and prevent certain major things from happening for the most part. And so hence that was my chosen profession.
That's fantastic. So in terms of defining what infectious diseases are, in my introduction earlier, I described some of the sources for infectious diseases, but how do you define what they really are, and maybe list out for us some of the ones that we are aware of, or maybe even that we're not aware of?
I have 2-3 very nice definitions, but the definition of infectious diseases occurring is more like the winning of the pathogen against us. Life and the world is a symbiosis of all the different microbiomes that occur everywhere in the world, and we have to understand that the microbiomes outside of our body find our body as their heaven and their pleasure, because we are healthy and they can utilize us to keep living and surviving. So that is how these pathogens get very excited to get inside our body, and once they do, they grow, and that's how infectious diseases gets produced.
And they're transmissible, contagious oftentimes, which can really be a problem, right?
Absolutely.
So what are some of the ones that we are familiar with, like a Lyme disease or a Hepatitis C or Streptococcus, strep throat? Tell us about some of the different ones that people might be familiar with.
Absolutely. As a matter of fact, I just heard about this case. When young children, or a lot of us adults as well, we are constantly, when the weather changes and the temperature changes, well, the viruses change, and when the viruses change, the bacteria change. So it's all a lot about the science and the physics, the chemistry that goes on in the world. Well, young children then suddenly get sore throat, as you can imagine. Just about everybody has it once a month, or as throughout their growing up. Well, I just heard about this one, and I can explain to you, and it makes such wonderful sense. That poor little girl got severe sore throat. So initially they said, no, it's nothing, don't worry about it. And after the second, third day, this one turned out to be unique. Started having fevers and was feeling really miserable, couldn't swallow. Went to the ER, and the ER checked her out, did everything, and they said, well, you know, just swallow these kind of creams, this, that, the other, eat this right food, apply the cream, sorry, to the outside of your throat, swallow these pills, and then, you know, it'll just get better. And initially they didn't give any antibiotics. They said it's going to go away, it looks like it's a virus. Goes home, comes back 2 days later sick again. This time, as things progressed, and they said, oh no, it does look rough, and they did a culture, and it turned out to be strep. So they gave her antibiotics, everything, and, you know, so thankfully the problem is solved. Child goes home. About 2 weeks later, is not feeling well, and is feeling really weird, and, you know, it says the heart is beating and feels like the head is hurting, and the urine color is changing like Coca-Cola. And the mother gets really worried and takes her right back again to a different ER, to the Children's Hospital. They did the full workup, and of course she had glomerulonephritis, which is a post result from the Streptococcus infection. So that's one Streptococcus infection. And your other ones that now, which is a real challenge to this wonderful nation, of course, and outside of this country with other parts of the world, we have different issues. For example, in Africa, Ebola virus is a major issue. Malaria, they've had it for years, they're working on it. Sleeping sickness when you go on tours, etc. And Southeast Asia, a lot of hepatitis and a lot of viruses and bacteria. But in our great nation, we're having issues right now with Lyme disease, which is becoming a real problem because we travel, we work out a lot, and that is a huge issue. We have certain viruses that are upticking, like measles is coming back, and certain big hospitals, big hospitals as well, actually, and universities and the military, etc. They tend to be exposed to meningitis, so the meningitis vaccine is coming back up. So essentially, with all these major diseases that are affecting us, and including hepatitis C, so there's a little bit of bad news, there's a little bit of good news, and there's always a preventable therapy, which is what I believe we have to focus on.
So it would seem as though when we have these various symptoms, you know, and if they're not symptoms that we normally deal with in our daily life, get them checked. Prevention is key, but if you start to feel symptoms, no matter what it may be, always go to your doctor and get these things checked, because you never know what it is. You don't know it's festering, you don't know if it's infectious, contagious, and if it could get worse, right?
Absolutely. Signs and symptoms are just about everything. And also our level of awareness. I mean, that doesn't mean that everybody has to know about anything. However, there are certain important issues which I think, you know, the government works very hard in trying to enlighten the knowledge of the citizens that in certain areas, if you go, you're exposed to certain things, or when you're a child and you're born, you have to get certain vaccines. There are purposes for all of this, and the main purpose is to prevent you from getting very sick and spreading it to other people, which is also an issue. So for all of these matters, you know, you do have to be aggressive and go and look for help. And the main thing is, when your beautiful body feels a little different than it normally does, we have to start paying attention.
Right, exactly. What are some of the things that cause infectious diseases?
That's a very good question. As we had talked about earlier, we have microbiomes, microbacteria throughout the rest of the world, and we have them within our body, surprisingly. And to give an example, the oral cavity, the esophagus, the colon, our skin, and our genital areas, and, you know, scalp, etc. They all have different types of microbiomes, and we need them. We will not be able to manage without them. They're our friends. So we have a good symbiosis with them, and they assist the immune system in working. So you may ask me, that sounds crazy, how? Well, because these microbiomes, they're helping our body, and they will not attack us completely. They're just sitting there looking after us, and they're getting fed, they're happy, they're getting paid well. They are preventing other bad bacteria from coming in. Now, if these good bacteria are not there, then those other bad bacteria make it easier to come in. Classic example, Clostridium difficile colitis. When we have to take antibiotics, or we have to do something and take medications, and our colon normal bacteria get removed, well, then the bad ones will grow. They are always there, bacteria in the body, always. So this is the combination of different bacteria, and that is how we get an infection. The other issue, how we get it, is two more big issues. One is our exposure. So let's say you and I have some small injury, or we don't have an injury, and we go swimming, we're diving, we're climbing mountains, and we're working in construction, and we're doing all these kinds of heavy works. What happens is some parts of our skin get a little damaged, or there's something in the air and it gets into our lungs, and it's entry. Through entry it gets in. And the last and the biggest and the deepest, quietest issue is our immune system. If our immune system is unfortunately not working, or, you know, it's innate or acquired, and both of them are not working well, right then and there we have these other two events occurring, and unfortunately we are at higher risk. So it is exposure, it is what we see, the microbiomes, it is the methodology in which it gets into our body, and finally it's how well our immune system acts against it.
Let's talk about also viruses themselves too, and how they actually spread.
It's a wonderful question. Viruses, they have been here for a very long time, and they're going to be here for a very long time. Viruses is really, they enter into our body mainly through the air, because as we breathe so many multiple breaths a day, so that's how they get in. Viruses have to be sort of alive and in the air, surprisingly, and you know, in certain other food or you know, chemicals, etc., that we're exposed to on a constant basis, and dirt, and sometimes through our animals we get some things too, our lovely pets, and through other citizens as well, our friends, etc., etc. Classic example is influenza, and the most sensitive option of that is when we're flying. If we're sick and not feeling well, like remember in the olden days, don't go to school, don't do this, don't do that, or don't go to work, just stay home for a few days. The purpose of them doing that was they knew that there was something aggravating you, and if you go and expose, it comes out and other people get it. So that's why they tend to do that. But nowadays it's not quite so easy. We take a few shots and get to work. And so despite us being sick, despite us being coughing, we get on a plane, and when we keep coughing, hacking on the plane, unfortunately we tend to give it to others. So viruses spread very easily and quickly.
What would you say in terms of infectious diseases are the more life-threatening and deadly?
Of infectious diseases? So the issues with infectious disease that completely get after us is, as we talked about earlier, the type of bacteria. Certain bacteria are lethal. Certain fungal infections, such as mucormycosis, aspergillus, and certain bacteria, like your group A strep, it can take you down completely. And necrotizing fasciitis that can occur when it gets inside your skin, spreads up. So these are the kind of names of a few bacteria which can really affect us. And out of your viruses, you have virus like HIV, virus like Hepatitis C, virus like Hepatitis A and B, and they get in so fast into the body, and it takes a long time. The other issue which is coming up more, and which is wonderful now that we are able to analyze it with the wonderful research and science that everybody does, is to see how well is our immune system functioning. And 2 to 3% of people always have, common variable immune deficiency, and it's a little bit low. But then remember, now we have come across with wonderful treatment patterns, say for rheumatoid arthritis or lupus, and we wind up taking medications like Humira, etc., which really saves your life from the rheumatoid arthritis, or methotrexate. But the saddest part about it is it dumbs down the immune system a little bit, and because of that you have a million little bacteria, viruses, fungi who know that and love to attack. So these are the names of some of the very potent organisms that can get in, and how they can get in.
Yeah, they can be deadly as well. So how can fungi spread through our bodies and be fatal once they're in there?
So there are multiple different fungi, and those are different too. So classic example is, for example, in Arizona, some of the it's called the river valley fevers. So I remember when the sand and goes up, and whenever you have the wind blowing, etc.
They have those sandstorms.
There you go, the sandstorms, they blow. That is the time, and they always tell you got to go in a cave, cover your face, or get into a building until that whole thing stops.
Yeah.
Please don't go out no matter what you do. The purpose of them saying that is because you have this fungi which can get in there, and things like coccidioidomycosis, histoplasmosis. These are all obtained through the air, and that's how they get inside the body. Now, to describe exactly what you said, the example is histoplasmosis, also known as river valley fever. What happens with that is when it gets inside your body, initially the body has its own wonderful innate immune system, and it gets at it and it completely controls it, and it's down and quiet. But say 4 or 5 years later, we all get a little older, we may get a diabetes or get some major surgery done. Surprisingly, that person keeps getting unusual things in the lung, or the bone marrow is acting funny, and the doctors are trying to figure out, why did that happen? Whatever we've done is okay. Where did this come from? So then they start analyzing, and they do biopsies, and they're stunned to see the yeast of the histoplasma growing. So basically, the fungus can get inside your body, quietly hide in there, and then down the line, when our immune system goes down, it ramps up, and that's how it flares and then gives us illnesses.
What about bacteria as well? We hear so much about bacteria, probably more than anything else. How does that enter into the equation and, of course, spread in our bodies as well?
Right. So bacteria getting into the body, once again, we have a microbiome. So that we can talk about down the line. But let's say you have in this wonderful country, we're also active. So we love to get out there, get in the water, climb trees, do work, we do amazing things. So remember, we are always exposed to the earth, we're exposed to trees, we're exposed to dirt, so which is always loaded with with microbacteria, and we can always get into it. And we injure our skin in different ways, and we breathe, so all of these bacteria get inside the body. Same thing as fungi and viruses. But the bacteria is one thing unusual. When it makes you sick, it really makes you sick right away and quite quickly. And the body is extremely good, and it will take you down within a day or two. You'll spike high fevers, you have pain, which is a blessing because you're aware of something going on.
It's a warning sign, right?
Absolute warning sign. And then we can go in and attack at it. Then you have some other unusual bacteria, which once again tend to stay in the body, difficult to remove. Example, Lyme disease. Example, relapsing fever. Example, syphilis.
Right.
So,
what about parasites too? Sometimes we hear about parasites entering the body as well. How does that actually happen, and what happens when that does happen?
so these parasites get into the body in certain multiple methodologies. It's a little less of breathing, but there's certain ones that come there, but mainly through eating, and is the way it gets in. For example, in a lot of countries where they don't have someone as wonderful as the FDA and who's very strict about things, how the food is controlled. But you know, there's a lot of rural areas also, which is sort of difficult to handle. But they're very wise. They've been doing it for years. They know how to control it. But through the food, certain bacteria get inside the gut. Excuse me, parasites get inside the gut, and once they get in, they can tend to grow and give us worms. So you've heard of roundworms, etc., and you can get extremely sick from that. That's very, very prominent in Southeast Asia and South America. Certain other parasites, and I saw a recent case which is incredible, gets in through trauma to our body. An example of that is the Botfly. So this wonderful young lady had been traveling to Belize and Costa Rica, and Costa Rica is actually very prominent Botflies. And she was in the beach and had the most amazing vacation of her life, her two young kids, and the young kids wanted to play with her and put her under the sand, and the husband took pictures and they had fun. And you know, it goes on, and then she comes back a week later and she keeps scratching at her leg and can't figure that out. Why scratching? And she went to the regular doctors, and they looked at it, and they did the right thing, gave her the creams and pills. Wasn't getting any better. Then after about a week, she could barely walk. So she was very upset. So she goes, she got to try something old style. So she takes a bucket, puts water, actually puts a little bleach in there and a little this, that, and tries to do something, and salt, and puts her foot in there. Well, when she puts her foot in there, she's talking on the phone, and then suddenly she sees something coming out, and she's aghast, and she tries to pick at it, and she and the husband, I mean, they're like absolutely panicking. And the minute they touch the water, it goes right back in. So, which means how good is it that it can sense the physics of it all. So eventually I get referred the case, and then Botfly. So we decided to admit her, take it out, and I was stunned to look at when the surgeon, it wasn't a small incision, it had to be an inch long on either side, because the larva was about 1.5 inches big. And I have pictures of that. Huge. And how did it even sit there? And she had the pain, fortunately, because of the ankle bones. Was it in a soft tissue of her body?
Right.
She may not have even noticed it.
That is absolutely amazing. These things that we can come across that we don't even realize in our daily lives, like you talk about Lyme disease, because you know, the summertime, a lot of people are out in the forests, they're hiking, they're in the woods. But now, and you and I were talking about this on the radio series, Lyme disease isn't just confined to going into dense jungle-like forests anymore. You're finding it all over the place, right?
Absolutely. The parasite/bacteria, we use both names for them. For Lyme disease, it's a bacteria, spirochete. When it gets inside the body, it is very, very, very potent and prominent, and the areas that it can get into could be anywhere around the country. Classically, it was described in the Northeast. Why? We believe it was a diagnosis that was made well first. Then the Midwest rather, and then all the way down to the West. California has a lot of it because of all the greenery that's there.
Yeah.
So I could go to Florida about 26 years ago, and someone comes to me with all these symptoms, and they show me these bullet rashes and everything,
Rings,
and then they start having a little tachycardia and fevers, and it comes, goes away. Then they get a little facial palsy, it comes and goes away, and they have weakness. And I said, my gosh, you're describing Lyme disease. So I said, let's test it. This no went to 2-3 doctors, and they said, no, it's not there. So I said, no, let's do it. And I was stunned to find all the titers were all positive. And then I wound up treating them, and then I started seeing at least 4 to 5 cases a year in Florida, and now there's an uptick. So it is definitely the weather changes. It is definitely, it's everywhere.
And that's pun intended, an uptick.
Uptick, exactly, well said, that's right, that's right.
Well, what you just said, and listening to your answer, definitively points out one thing for me, and I'm sure for our audience as well. And it's one thing that I garnered early on when we did the radio series, like what you had said, where that patient had gone to other physicians and it was being written off as, you know, maybe you got the sniffles or Epstein-Barr virus, or it could be all these other different things. But you went the extra mile. You were not satisfied with the answers that that patient presented to you that were coming from other physicians who just wrote it off, and said, I want to do further testing. I see something beyond what you've heard before. There's something else going on here. That is typical of how you operate with your patients, right? You go that extra mile. You will take the time to dig deeper to find out what really the root cause of things are.
And thank you for saying that. As the way I grew up, and then the way I came here, and all that, and I've been blessed, and I've been having the opportunity to take care of so many people. After I talk to the patient, I'm listening very carefully, and the patients are wonderful. They tell you the truth, they tell you where they went, what they did, and why they're not feeling better. And then, you know, when the day ends and you go home, you're sitting and thinking, that patient's not better. And you look at your schedule for the next week, the next month, the poor patient's coming back, and I'm thinking to myself, I need to know what I'm doing. I need to make the diagnosis. I need to dig deeper. I need to look into it. And when you do that, you really will be able to make a difference and help the patients get better. Another classic example, as we had talked about earlier, there's this absolutely delightful patient who was admitted, and the patient had been admitted to the hospital almost for 10 days for just jaundice, and nausea, vomiting, was not feeling well, and was just feeling miserable. So all the consultants were called by the primary care physician, of course, immediately the gastroenterologist, and then the surgeon, possible gallbladder issues, this, that. And they ordered the hepatitis profile, and they're waiting, and they're waiting and watching, and at about day 5 or 6, it comes back positive for hepatitis A, IgM, which means it's active hepatitis A. So the patient is awake, alert oriented, not in the intensive care. So some of the doctors sign off the cases. There's nothing for us to do. Patient also had developed kidney failure, and the white count had dropped down, and so they had got the oncologist, so like 5-6 consults on the case. So after they recognized why it occurred, they backed off, and 2-3 of them signed. And at about day 12, the patient spiked a fever. Now, should I say that's a good thing or not a good thing?
Right.
But at that point, they consulted the infectious diseases, and I went there and chatted with the patient and took the whole history, read all the notes. Now the notes are were huge. I read everything, chatted with the patient. He's married with children. He's a wonderful person, and very, very nice person, and strong and young and active. And as we're going on, but you know, after about 2-3 days after me seeing him, you can see the discomfort, because I'm already trying to figure out, is it time for discharge for the patient, which is important nowadays, and how can I make plans for him when he goes home, etc., etc. But I'm looking at some of his numbers, and certain numbers improved, but certain didn't. So I'm not happy with that. I'm like, I just don't see why this is this way and why its numbers are this way. So I had to take a bold step, and I went and chatted with him again, and I requested the HIV test, and surprisingly it was positive. And so I went back and chatted with him at great length, explained to him, and before I even gave him the answer, I told him, please don't worry about anything in this world. We have wonderful treatment plans. We have wonderful methodology. You're going to have a very good life. All it means is just taking another pill a day, which is, this great country has made such advancements. So then I talked to him, etc., everything. And now we're about 6 months later. He's doing extremely well.
That's fantastic. That's amazing.
So that is an unusual, interesting case that had.
And as the person that's facilitating this, how does that make you feel?
It makes me feel good. It makes me feel as I go home, I sleep well, that I did my job, and that is what I'm here to do, and I should do it. And it makes me feel wonderful. Thank you.
It's got to be really something deep,
Yes.
And it's what drives you to continue doing the work that you do.
Absolutely, sir.
So, prevention. I know that prevention for you is big. It's paramount in the conversations we've had. What are some of the things that we can do in our daily life to try to prevent infectious diseases, if we can at all?
That's a wonderful question. There are so many multiple things that we can do, and we can talk about it in different areas. To put it simply, prevention of an infectious diseases is if we're traveling, we're going to different places, or we're working in construction and we're exposed to different chemicals. With all of these issues, we have to do just a little bit of knowledge research on that and recognize that and figure out what we are at risk of. So if we ever get traumatized with any of those matters, then we have to immediately work on it. The other main issue is we have done wonderful things in this country over the last 100 years with the development of vaccines, which is really phenomenal. And vaccines were critical in being developed. Why? Because as a government is handling an entire wonderful country of people, and who are busy with their lives and living good lives and doing their things, there's certain viruses and bacteria and parasites that can come and just attack. So as a government, we would love to prevent that from happening. And the way we do that is the utilization of vaccines. And also, we do not want the people to get hurt. So examples of amazing vaccines that have been created are against polio virus. And one of our great presidents also had polio virus before the vaccine was developed. And so it is just about eradicated. Smallpox is another big one. And of course, you have your diphtheria, the whooping cough, the one where you cough and the children can't breathe, and it's just awful to see that. And tetanus, so the workers, etc., going out in the lawns, they will get exposed and they get tetanus and get very sick. So these are very wonderful preventable illnesses that vaccines are present. The newer ones being developed, and which are really amazing, are that for hepatitis A, hepatitis B, and they're seriously working on the HIV. I'm sure in a few years we'll get that. Lyme disease had a vaccine, actually, and there are some issues with that. I'm not exactly aware of that development, etc., but it did work. But they're looking at it again. They're trying to look at it again and develop those vaccines. So it's exposure, and it's with the utilization of vaccines. But there's one other most important thing that most infectious disease or people tend not to communicate about, and
is that to wash your hands?
Thank you very much. I'm glad you said it that way.
That's one of them, right?
So, and that is our body, what you and I have to do on a daily basis, whether we can read, whether we can't see, we're available, we're not. The wonderful culture of that comes up with some of our ancient cultures, the Aborigines in Africa, our Native American incredible people, and certain, the Mongols out in Asia, and a lot of those. What I would like to talk about at this point would be, we have to take care of our human body. How do we do that?
So it's like our temple.
It is, and we have to work on it very hard. We have to eat right, do right, try not to get ill by creating those illnesses, work on our immune system. And as we all get older, we're all at risk for developing diabetes, and we tend to be, and the food that we have in this wonderful country now, the food industry is going to be very unhappy with me, but it's the availability of outstanding food. So we tend to eat fast food, etc.
Preservatives and chemicals and
When we keep doing that, our blood sugars get very out of control. In the olden days, diabetes was very rare. Now it is very common, and it has to be the type we eat. Yes. So we get exposed to all those things. So in other words, so if we cut down the amount that we eat, and then of course, the heavy alcohol. I mean, some alcohol is good. It's good for all of us. We enjoy it. And here and there, a cigarette or two or a cigar, there's nothing wrong with that. But anything else that we do more frequently than the body, excessively, it it takes away some of our soldiers, some of our weapons, and we become at high risk at that point. So it's an array of methods in which we can prevent infectious disease.
So there are common things that we can do, like in the daily lives. I know we laugh about something as simple as washing your hands, but growing up, our parents, our mothers especially, would say, now wash your hands before dinner, or wash your hands when you go into a public bathroom, or whatever it is. But that's really important, because sometimes or cover your mouth when you cough or when you sneeze. All these things that are so basic that we've heard all our life really stand true, right?
Yes. And the most surprising thing is, out of respect for all our elders and the ancestors and the generations, they found methods of saying it without saying it in a different way. So in certain parts of the tropical countries, you might not have soap, shampoo, so they tell you go and bathe 3 times a day. And because you're washing off certain things, and that helps you to feel much better. And cleaning your hands and washing your hands, as you said, is critical and essential. So if you're exposed to anything, any substances, I'm not saying it wash it every minute, but if you're exposed to any unusual things, then you really should wash your hands when you get into the house, or before you eat, before you cook, before you do things, before you do certain private things with the family.
Public areas too.
Public areas too. Once you come out of a public area, just go straight and then just clean yourself up and get right back to normal. So those kind of things are really wonderful.
Let's talk about the body in terms of the immune system's ability to help us sort of ward off infectious diseases. How does that work?
The immune system is incredible. It is our warrior. It is our military. Without it, we will not be here. That is something very difficult for a lot of people to understand. But the immune system is everything. So what I recommend, encourage it, and that's it. The immune system is divided mainly in a simple way into innate and acquired. So the innate is what you and I are born with, thankfully, good genes coming in. And we have the parents' genes and the ancestors' genes that comes in, and it has learned over the years how to fight all that microbiota that are out there. So that is the innate immune system. So anything that you and I, by the grace of God, are immediately exposed to, our innate immune system instantly gets in there and acts and takes care of it. It wins 99% of the time. That's incredible. That's an incredible set of warriors. Then you have the next set of warriors, which is called the acquired system, which is really very important. And here's where the immune system doesn't need the brain to use it. The immune system, if it is exposed to a particular antigen or a parasite, fungi, all those different kinds of infections, once it is exposed, he uses his brain. He doesn't just sit there. So he looks at it, and then he starts multiplying his little genes in different ways, and goes back here, goes to the bone marrow system, which is wonderful, the thyroid, the thymus, and the rest of our lymph nodes everywhere, and says, okay, we have a problem coming, you need to develop this. So the rest of it will instantly get on it and say, the immune system is telling me what to do.
Right.
And it will copy, and it will mimic, and make several new soldiers, and it will multiply tens of thousands of them. So let us say that antigen is still coming in on a regular basis, then this keeps getting higher and higher volume, and it goes and it's able to attack it completely. That's the acquired immune system, and it is 100% effective.
That's incredible. It really is. The body is a magical thing. It really wants to heal itself. It wants to take care of itself. It's just, we have to help it do that.
Absolutely.
We have to help facilitate it.
Correct.
One of the things, too, that people use are antibiotics.
Yes.
How do antibiotics help with infectious diseases? Because I know lately you've heard a little bit of controversy, some people for antibiotics, some people now steering away from antibiotics. You're the expert, you're the professional, you've been doing this some 30 years. How do you feel about all that and the value of antibiotics, specifically when treating infectious diseases?
So medicine has changed a little bit nowadays. Not that there's anything wrong with it, etc. There's a little bit of a different structure. It's a little more corporatized than what it was way back then. Is that good or bad? Certain areas benefit from it, but I do feel that sometimes what a physician is instructed to treat the patient might be an issue with that. And of course, we are constantly always conscious of the fact that the patient has to have the capacity to pay for the treatment, and that we deal with it every day. So for us, it's nothing new. So in a sense, we're very conscious of the financial issues. So the treatment with antibiotics, as wonderful as the CDC is, the IDSA guidelines, and the history of several different countries and the diseases that they have, and they've produced the research, certain infectious diseases has to be treated with antibiotics, and the duration of it is the key. And the CDC is very particular, and so is the IDSA. And I respect that, and that's why we read it all the time. They give new guidelines, etc. The purpose of doing that is, if we don't do it, of course, then someone should take action, and I have nothing against that, because that poor patient suffers. Now, to give a classic example, if someone is just having a urinary tract infection, 1 or 2 days of antibiotics really fixes it, but we are supposed to give 4 or 5 days. But let's say somebody has something like osteomyelitis, which is of the spine, or discitis, or an epidural abscess, which is deep and it is inside the bone. That takes 6 to 8 to 12 weeks. Now, you cannot give 2 days of IV antibiotics and switch them to pills and send them, because without a doubt that's going to fail.
Right.
Why does it take that long? Structure, the bone, the physics, and the chemistry. Where through the antibiotic has to get into the body through the blood. When it gets in through the blood, it has to leak out and get into the bone. So in order to be able to do that, it takes a long time. So lately, how things have changed. Of course, there's always both sides. Sometimes some people kept a patient for a little too long for a treatment. So we have to optimize it and use antibiotic stewardship and do it the right way. But I will tell you, cutting down all the intravenous antibiotics for a lung abscess, for a liver abscess, for osteomyelitis, for endocarditis, that is an absolute no-no, sir. We have to follow the guidelines that are there, and if you have doubt, follow the guidelines. And here's the thing, no one will deny the care, because it is a guideline.
Right.
So it helps the patient to get better, which is what we're here to do.
Let's talk about, again, some of the ways that we can come in contact with or acquire infectious diseases. One of the things that a lot of people like to do is swim in lakes and rivers and streams and oceans. Doing something as pleasurable and simple as that can also sometimes lead to acquiring an infectious disease, right? That might surprise some people.
Absolutely. There are so many bacteria and parasites that we can be exposed to when we get into the water, and that could be the oceans, and it could be the lakes. So as it is challenging as a patient to figure some of these things out, but however, when you know you're going on a boat, when you know you're diving, when you know you're going to a lake or going to this country, that country, it would be wonderful if you could do just a little bit of research and awareness, and also look into what bacteria, viruses are prevalent in that area, and so you can know how to prevent yourself. To give a classic example, when anyone goes into the water, we have normal skin and healthy skin, we're going to be fine, because the skin has protected ourselves through eons of generations. But let's say we rub it or we injure it or something, have small trauma, and that's all it takes. Those bacteria, they find that little hole and they just jump right in, and then you can get Acinetobacter, you can get Vibrio vulnificus, which is a huge problem. Vibrio is a very sensitive process, and I don't mean this any way, but sometimes if some people have cirrhosis of the liver, the cirrhosis of the liver could be due to multiple things. They have genetic diseases, or they have some kind of hepatitis, or they have alcohol intake, which is preventable, easily preventable. And unfortunately, and they want to have a good time here and there, and they get into the water and their legs are red, they have some issues, and Vibrio vulnificus in such a patient can be fatal within 24 hours. So that is why we have to as a doctor, as an infectious disease, it's all about prevention. We communicate with them, because they go on trips to Bahamas, etc. And I have the list of their diseases, so we have communicate with them.
Right.
The other very, very sensitive process, and it's a very, very rare, but it does occur, and most recently it occurred to an infectious disease doctor and her son.
Really?
So for example, salt water, fresh water. And is the lake exposed to others like Michigan? It's completely exposed, so it's a very big. So even though it's a lake, it's really more like an ocean.
Yeah.
That's safer. And when there's salt, it's safer. But when it's fresh water, there's a slight risk. So what happens?
Why is that? Is it because it's stagnant, or what is it about the fresh water?
Heavy salt, heavy sugar,
Yeah.
like for example honey, the bacteria cannot grow in them.
Right.
But if you have a small amount of them, it can.
Yeah.
So, you know, when we all dive, and there's nothing wrong with diving, but for example, if we go in valleys and you have wonderful little lakes there, we are, you know, it's
Little
beautiful.
coves and
We wanna dive. We wanna have fun. You know, when you look at the way we're taught to dive, you always have to put your head down and jump. But sometimes, you know, we just want to be wild and we just jump and go straight down like that. The unfortunate thing is we are increasing our exposure. So the water if you close your nose, you're in a better position. But if it goes straight inside, it can absolutely get inside the brain. Amoebiasis, Naegleria fowleri, and that unfortunately is a very big problem, because most of the time it is fatal. So it gets inside and the person starts getting sick the next few days. It occurs very rarely, but something like 6 to 10 cases a year described to the CDC. So it's just everyone can go out and have a very good time, as long as they're exposed, as long as they're aware that they're going to be exposed, and as long as when they come back, they don't feel good, they should immediately seek help.
Touched upon hepatitis C recently in conversations on the radio, and just a few moments ago as well. Have we been making progress? You're hearing much more about hepatitis C lately too. Sort of, you didn't hear much about it, but now it's in the news. They're telling people go get tested for it. And has progress been made along the way as a result of the publicity of it and people taking action to find out if they have it?
Absolutely. Hepatitis C is one of the most wonderful disorders which the government has been able to work upon, and the research and the scientists, and we actually eradicate it completely right now in the easiest possible ways. We're talking 6 to 8 weeks of pills once a day. It's gone. Your life is saved. In the past, what wound up happening is the baby boomers, so they were exposed to hepatitis C. It was known as non-A, non-B. And no one was aware that it was around like that, and they would test the blood and it would look like it's not A, it's not B, but it is hepatitis. So finally, eventually in the late 70s, 80s, they gave it a name called hepatitis C. And as time passed on, very difficult to find cure for it. Hepatitis C is a little like hepatitis B. It's softer and slower. However, it stays in your body, as we talked about earlier. And when you cross 50, 60, so you've had it now about 30 years, 25, 30 years, it starts flaring, and the liver can't take it anymore.
So what actually starts happening? What are the symptoms and what are the results of having it that long?
Progressive weakness, different kind of infections, constant nausea and belly pains. And when you go in there and you do the analysis,
rough stuff,
right, and their white count starts going down, and when you and the patient starts putting on weight, excessive weight. So when they start analyzing everything, you'll see that the patient is diagnosed with hepatitis C and has full-blown cirrhosis of the liver. What wound up happening prior to about 30 years ago is those patients, they're just looking at death. So they decided to call the transplant surgeons and transplant that liver. Well, what wound up happening because of the baby boomers, etc., and the increased availability to health, the number of patients going in for the liver transplant were excessive. Well, the cost of that would be, name it, 5 to 10 million. And the transplant surgeon said, listen, in the beginning we had 1 or 2 a week, now we have 7 a day. We cannot do this. And the reason they said that is not because of the work, but it was because obtaining a new liver. So it was very difficult to obtain new livers and transplant. They said the amount of people that are getting this or get full-blown cirrhosis and are moving the wrong direction, we don't have enough livers to get. So then they made noise, went to the FDA and said, do something. You have to find it. Please talk to the scientists and researchers to find treatment. So then it started. So initially it was interferon and rifampin. When people were taking it, it was working, but the rifampin had a lot of side effects. Patients were getting very sick, and you take shots once a week. It increases people to do drugs, and it wasn't working very well. It did cure, I would say, about 20-22% of people, but you still had the other 85. So in the last 6-7 years, it was just amazing. They came out with this medication called Vicura Pack, and it's huge, a big bunch of pills, and you take all of it once a day, and then you take it for a few days. Very expensive. The cost is, we should talk about the cost of everything, $150,000. So now you can absolutely imagine the challenges of that. I mean, that's beyond a lifetime, saving for diseases, and how can anybody pay for that? So it was a challenge for the insurance companies, particularly for the managed care. But also,
it's probably a challenge for the doctor too, for somebody like yourself, because oftentimes you want to provide the care and you know what needs to be done and you have this plan, but then when it is either a lack of money issue or maybe a health insurance company doesn't want to pay for something that you're recommending can really help them, that's got to be frustrating at times for somebody as an expert of yourself.
Absolutely. And the other issue was with the Veterans Administration. They and our darling veterans, because of the entire world that they're exposed to, they tend to, and of course because of things that they do, they're exposed more and they go to different countries. So that became a very big challenge. So because of, and you will treat a veteran for what they have, and that 150,000 became excessive, and because of our great government and the Constitution, they could not get a lower price. So, but fortunately, once again, corporation and business is wonderful, because different pharmaceutical companies recognize that this is something that could be done. So several companies came out. Now the price has dropped down to about 35,000, and we're in a way better shape. But the most important issue in that, I would love to tell you, the patients loved it. They wanted to get treated. The transplant surgeons were celebrating, and finally the VA felt very good about it, because they also wanted to treat all their veterans. But the most interesting fact in this is the insurance companies. I can understand, we understand why they were upset about it, but as time passed, they began realizing, they started seeing better results. The patient was not admitted multiple times to the hospital, so you get to save 5 times as much money.
Savings happening.
And imagine, they don't need a transplant. So the insurance company did really well. So then guess what? Now the insurance, even if you don't have it, they'd like to treat you for it. So it's a wonderful process.
Exactly, right.
It was a wonderful scheme, the situation that really worked out well.
Everybody was winning, including the patient.
Absolutely.
Which is the key, which is fantastic.
Really worked out very, very well. And we love to do it with all diseases like that.
Right. One of the things we touched upon a little bit earlier was HIV. And are there future breakthroughs that are sort of, we're on the cusp of right now?
Absolutely, and that is one disease that we should all talk about, because not only is it in certain parts of the world, it is worldwide. And this wonderful nation, it takes care of its citizens so well. In a lot of other countries, they're not able to afford it. So HIV, way back in the 1980s when I was doing my medical school, etc., it had just come out, patients were dying, it was sad, it was very unfortunate. It really didn't look like there was any possible treatment, because it was a very, very tough, vigorous, nasty virus that did its job, and we couldn't make it. And so they had to work exceptionally hard, and the extreme amount of money and time and energy had to go into it. But we used all our capacity and methodology, and the government certainly helped, and the public also was, talked about it a lot and said that you have to find something, you have to help us. So eventually, as we approached the 90s, we started getting very good solutions. We started getting some medications, and of course it was 6, 7, 8 medications taken in a fridge, going here, going there, and it all rapidly did so much better. And now we're down to 1 pill once a day, which is phenomenal, that component of it. And going back about in the last 10 to 15 years, HIV, we're not worried about, we worry more about diabetes than HIV. So HIV is completely controllable. So that is absolutely, the issue was relatively gone. But as time continued to pass, some of the older patients that have it, etc., they started saying that, can you find a way to get rid of it? Now you've cured hepatitis C, why don't you get rid of it with this? So what wound up happening, they started analyzing it, and once again, you have to do all the research. They were able to find a few things. They were able to find that there were certain patients who were totally exposed to HIV but didn't get it. and it's called the CCR5 mutation. When they analyzed those other people, they found that they didn't have it, or partners, etc., or somebody was exposed. And they said, how come this person didn't get it all? And they recognized this particular mutation. So our country is very conservative. It waits for absolute good approval, it waits for good methods, only then will it approve it, and there's nothing wrong with that. In certain other countries, because the patients are so much sicker and there's no money at all, so they'll say, well, let's try it on these patients. A lot of people volunteer. So there was this one actually American citizen, and it had come all over the news, who went to Europe, and he wound up developing lymphoma because of he had HIV for over 30-40 years. And to receive the treatment for that lymphoma, the physician over there was phenomenal, the oncologist physician and the infectious disease. They sat and thought, that said, wait a minute, so if we transplant his bone, why don't we do it with a CCR5 mutation? So they went ahead and did that. It took them another 6 months to find someone in the rest of the world. They put it in the news, they did everything. And guess what? He doesn't have HIV anymore.
That's incredible.
So his body could
That's
not,
amazing.
so that microbiome, the immune system had up-ramped itself, and it can't get in and it can't act, so it's done. So it was surprising. So till today, they still continue to check his titers, and he's back home containing his other medications. He's doing fine.
It's amazing.
Phenomenal progress. So of course, the CDC, the IDSA, and the NIH, which is phenomenal, does a wonderful researchers. They're looking into it. So I know this is a unique terminology, but when you want to create a particular mutation which doesn't affect the body, but it's different, it's called the utilization of nuclear scissors. So the NIH is doing a tremendous research into giving certain chemicals that cause nuclear scissors. It's already all over in the health departments. They're doing studies and analysis. I really feel in 5 years, 10 years, we'll be in a position as we were in hepatitis C to eradicate it. That's
fantastic. It's very positive news, Doctor. Something called symbiosis. Talked a little bit about that on the radio show too. Define a little bit for the folks watching right now what that actually is.
So symbiosis is incredible. It is, as we had talked about earlier, the microbiomes that are outside of our body, the microbiomes that are within our body, and we can talk about a classic disease, which it is such a sensitive process to, and that is our colon. So, so these kind of bacteria that are there and not there, that should be there. If they're not there, then we need to ensure that they are there. And so how do we get it in? So for example, if you take this disorder, C. difficile colitis, so what it is C. difficile is in all our bodies. It's sitting in there, but because of the other good bacteria, the good microbiome we have, it's controlled, and it helps our immune system hold the others down. What winds up happening is either you have to have some chemicals, or you take some washings, or you have to take heavy antibiotics for other disorders. It eradicates the normal bacteria. Well, once that happens, the C. difficile is so happy, he starts rapidly multiplying and growing, and then you get C. difficile colitis. So we can treat that with medications, but it is not, once again, it's not a simple disease. It's something, because it's such a sensitive process that you have to work on, you know, it's not just a math, 1, 2, 3. So what winds up happening is you get severe colitis and high fevers, and you get very sick. You can proceed towards sepsis, and unfortunately, patients who are above 80 years old, they have the maximum C. diff, and then they can high risk of death. So trying to figure things out, trying to figure out how can we do this. So then slowly you come across probiotics, which just about everybody takes the probiotics, and they take it in the pill version of it. But as times passed, it wasn't working well enough. So we have to come up with something, and they start analyzing, as the CDC and IDSA analyzes everything around the world, and they came to find out a lot of things. So bottom line, so what they decided was, how can we introduce healthy bacteria into a human person and then get back to the normal microbiome that we have? So anything that's fermented, and this is fascinating. The fermented foods are present in different parts of the world. So for example, yogurt, buttermilk, fermented milk called kefir, which the Middle East uses that.
Yeah.
Buttermilk is very famous in India. They cannot live without it. And yogurt is everywhere. So that's one. The other thing in America, what we use a lot is sauerkraut, and of course kimchi. Kimchi is from Korea, and kimchi is incredible. And the way it's done is a jar is taken, vegetables are put in, ginger, garlic, Korean chili powder, etc., vinegar, and it's all put in and it's fermented. Now, it's very surprising to imagine how can something be fermented and how could I still eat it? But because of that heavy salt, ginger, garlic, and vinegar, bacteria cannot grow in there, bad bacteria. But the good ones, it's healthily fermented. And then so you bring it out, it tastes fine. And the kimchi, so Korea is very famous for it. They have no evidence of C. diff colitis, I can tell you that. The other one is a sauerkraut. Now, if you look at our country, Hawaii, do you remember like under the ground they put wonderful meats and they ferment? So they also do very well and do good. So these kind of oral intaking of healthy bacteria does us very well. Now let's say we come to a certain other situation where despite all of this and the medications, patient's not getting any better. So what can we do? This is a very sensitive process to communicate with, but if it saves your life, we should look into it.
And listen up and listen close, right?
It's incredible. It's called a fecal transplant.
A fecal transplant?
A fecal transplant.
Never heard of that. What is this?
Yes. So fecal transplant is something which is a lifesaver for multiple illnesses, not only C. diff, but a lot of people. It's not documented from the FDSA CDC guidelines, but they're looking into it for possible ulcerative colitis and possible Crohn's disease, and a lot has to be analyzed before you can consider.
Right.
But coming back to the C. diff colitis, how they do that is they have to obtain the feces from healthy people with no other illnesses, obviously, and it's worked upon, it's actually blended, and then you get the decanted fluid. And as unusual as it is, the decanted fluid is pulled off, and into that they put in heavy probiotics, and they put in a certain, if necessary on that particular patient, a particular antibiotic, and then you create in multiple syringes different kinds, and it's actually fairly clean at that point, because really the stool is all removed. The whole concept of blending and removing it with decanting it was to get the healthy bacteria out. So anyway, so we will forget about that, we've thrown it out. So you take these syringes, and in two methodologies you can put it into a person. One is patient undergoes an endoscopy, and they can introduce about 20-30 syringes that way. The purpose of doing that is because you can introduce it through the small bowel and go past it and get into the colon. And then once that is done, you do a colonoscopy at the same time, and then right from top to out you do the same thing. So you do that 1-2 times. It has saved the life after life after life of a person who was otherwise in hospice care. And then there's a lot of issues with guidelines, etc. And the pharmaceutical company was not happy. They wanted to do that through pills. And remember, it's very difficult to make it through a pill version. So the gastroenterologists and the other infectious diseases and surgeons created a different methodology, and that is they through getting it as an enema. And they would be in a position to introduce that as an enema, and the patient can come a couple of times a week. All you have to do is do 2-3 times. You're saved. So it is a miraculous new methodology of thinking, which we should always expand our mind and think.
And then there's basic things we can do too that I know, again, getting back to the concept and the mindset that is very important for you, which is really prevention. In any way, shape, or form, you know, during our daily lives, to prevent some of these things from happening as best as we can. Now, you can't prevent every single thing, but some basic things like diet and exercise necessary to keep us healthy, to protect us from the diseases, right?
Absolutely. And that's the most wonderful opportunity you talked about. And what that is called is wellness. So you and I at any stage, every stage will consider wellness, and it should become you know, in our subconscious. So it acts and does it well automatically. So exactly like you said, the type of diet. We have to tend to eat natural, free, healthy food, and you know, lean meats, vegetables, and your buttermilk, yogurt, kimchi, etc. Here and there. But the regular food, try to avoid you know, processed food.
Yeah.
The purpose of that, and I'll tell you a little one about that, which is unusual, but I will say that, and then I'll proceed on with that. But they did tend to notice, like a lot of the pathologists and the autopsy people noted, that they were stunned to see that normally a body tends to degrade quickly.
Yeah.
Not anymore.
Wow.
and they couldn't figure that out why. So they started doing biopsies, and they realized, my goodness, if you overeat processed food all the time, it creates issues because the chemicals in that ruin our cholesterol, and it just keeps us unhealthy. So coming back to that, so eating the right types of food, and even if you don't like it, if it's good for your body, eat the broccoli, eat the Brussels sprouts, if you can, and some fruit every day, and milk. If you can't have milk, you have almond milk opportunities. So you have to try all those tricks. The other issue is exercise. Exercise is everything. Exercise revamps our body, and it doesn't have to be a crazy wild 2, 3, 4 hours or high power, heavy. It's just sometimes those things are very strenuous for the body, and we can harm ourselves.
You can overdo it, right?
Absolutely.
Exactly, yeah.
And we get overexcited, and we're overexcited 1 or 2 days, and the other days we get tired. So that doesn't work.
Right.
So you cut it down and do about 15, 20 minutes a day is all you really need to do. And anything, either go for a very nice long walk, come back and do some stretching, some resistance training is incredible. And if you have the capacity to do it, then do some aerobic training. And in between that, always, beginning and end, stretch.
Stretching is very
Stretching is critical in certain Asian issues, for example, like yoga or your taekwondo or any of your karate, because they recognize that if you don't stretch, the tendons don't move, and when the tendons don't move, you can't perform your martial arts.
Right.
So eating, and then dieting, and eating. Dieting has to be done very well too. We should not overeat fat, overeat those kind of issues, so we keep our cholesterol in a good number.
And not stop eating completely too. Sometimes we take it to the extreme where we just stop eating completely, and that's not healthy either.
Absolutely.
Because your body tries to compensate.
So we cannot have malnutrition or overnutrition. So outside of this country, malnutrition is present.
Yeah.
In our country, overnutrition. So we have to monitor those two. And then the daily exercises. And then we have to talk about something else that actually works on both of them as well, and that is the mind.
Yes.
And the happiness of the mind, and that sense of well-being. They did a lot of analysis, and they analyzed HIV patients, so tremendous research had gone in the 90s to 2000s, and then they looked at it, and they realized that even if somebody has good numbers, is on good treatment, they somehow weren't doing well. But the other ones were doing better because their mind was active and happy. So we have to keep our mind very healthy, keep it elevated, and know that we are on this earth for a good life, and we deserve every good thing. And we can work on ourselves. We can maintain all of those issues and stay well, and physically work on it, do the right diet, and keep wonderful friendship and relationships with people like yourself, Jim.
It's important. It really is very, very important.
Thank you.
Again, this is
wonderful,
incredible information that you're revealing and sharing with us, and it's vital, it's impactful, it's very important, and it's also hopeful too, because you're talking about situations where there is the capacity to control and or reverse some of these infectious disease situations that we find ourselves in, right? That's very positive information for the viewer right now who might not realize that some of that is available.
Absolutely. And thank you for giving me the opportunity to even say this, but I do encourage all of the people and the viewers, to always, if you always feel good about themselves, and you're here to enjoy your life, to achieve the things that you want, and to experience wonderful things, and you can do all of those things as long as you avoid certain things, or if you're still forced to go through it like our dear soldiers. Let me tell you something, they are taken care of so well. They receive the maximum vaccines, and the equipment is built in such a way that it's just about impossible for them to be exposed to things. So the risk of illnesses is markedly lowered, and the soldiers can really perform their job. Absolutely. So just like that, we civilians, wonderful, we should have the same situation. So we can take care of ourselves also very well. There are many capacities.
Well, you're on the forefront of really tackling it head on, and sort of like in that immediacy, which is very important too, because every day there's probably new diseases and new strains of diseases and new things that are developing that you're witnessing, right? It's not always just the flu and just the different, there's new things that pop up all the time.
Yes.
So you have to be on the forefront and on the cutting edge, which, doctor, you are. And I know that just in the times I've had an opportunity to interact with you and engage with you, you do this work because you really care about people. It's the human condition that you are concerned with and their overall health and well-being. So it's a wonderful career that you're in, but you're doing it for the right reasons to help save people, to help people heal, to help people live happy, healthy lives. And that's the bottom line for a physician that really cares, right?
Yes, absolutely. Thank you. And yes, that is what it's about. When you are a physician and you are practicing a subject that can prevent illnesses, and once it turns up we can eradicate it, that is it. That is what we want to do constantly and all the time. And we want to give back. We want to give back to the wonderful community and this great country, and we want to give back for all the pleasure and honor and the dignity that we have of being able to learn all those things. So we love to give back to the community.
I want to let folks know as well that you have a practice that's in Florida, and you are in the midst of writing a book. There's speaking engagements you're working on, and a lot of really exciting things as an expert of infectious diseases that you sort of have up your sleeve that you're perfecting right now too. Writing a book must be an exciting process.
Thank you. Yes, it is. And challenging as well. We have to look into the facts and timing, but the most important thing is the passion and what means the most to you and what you can give back, and we have to make sure that all comes out in different ways, and I think I'm really excited about it.
It's wonderful to have you here, Doctor. Thanks for joining us on CU TV News. And people could, of course, check the websites, check the internet, learn more about you as well through the internet and so much more, because you're very accessible.
Thank you very much. And it was an honor and a pleasure once again. And I'm here to serve, sir. And thank you for giving me this wonderful opportunity.
It's our pleasure, and a pleasure to meet you again after all this time we've done these radio shows, and to have you here in our studio and share all this vital information with our audience. We really appreciate it, Doctor.
Thank you very much, sir.
Thank you very much as well.
It.
And thank you for joining us. I'm Jim Masters, CU TV News, a very special guest, infectious disease expert and doctor, Dr. Vatsala Sastry. Office and practices in Florida. You can check out the internet and websites for more information. For all of us, the entire team here at CU TV News, we thank you very much for joining us for this episode. We'll see you again soon. Bye for now.